Here in Canada, Quebec has become the third province to report a presumptive case of COVID-19. This patient, a woman from the Montreal area who returned from Iran on Monday. She went to an outpatient clinic that night with minor symptoms and after testing positive is now in self-isolation at home. The National Microbiology Lab in Winnipeg is carrying out a second test. This will confirm the original result, and its result finally is expected on Sunday. This is Canada's 14th suspected or confirmed case of the disease. Earlier yesterday, Ontario confirmed a 6th case, and we know there are 7 in British Columbia as well.
This virus has pandemic potential, and WHO is providing the tools to help every country to prepare accordingly.
The WHO, prepare accordingly and aggressively. That news conference was on the air right about now, yesterday, live on CBC News Network, and you heard the WHO director in the course of that say what a decisive moment this is. And countries need to be ready and need to be thinking differently to prepare in order to save lives. Still focusing on containing, but in case there is further deep community spread, there needs to be a whole different approach. And John Northcott is here as we talk about what Canada is doing after, not in direct response to what we heard yesterday, but we certainly got the strongest language to date from the WHO on what countries like Canada need to do.
Yeah, when you talk about pandemic potential, you mentioned Mexico earlier with new cases. There are new cases as well reported in Belarus, Lithuania, New Zealand, Nigeria, Azerbaijan, and the Netherlands. So this is a case where when they say pandemic, that doesn't necessarily mean the depth of it in terms of the number of cases. It means the breadth of it in terms of pan around the world. And that is what healthcare providers are focusing on in terms of how can they have anticipatory ability to deal with the situation as it potentially grows and spreads around the population. So let's look at the number of countries, a list that we have now of countries where if you show up at a Canadian hospital with flu-like symptoms, you will be automatically tested for the coronavirus. So China, Iran, Italy, South Korea, Singapore, Japan, and Hong Kong. Now, there is, in anticipation of a potential pandemic declaration by the WHO, health officials in this country are talking about, you know what, if someone shows up with flu-like symptoms and they haven't necessarily been to one of those 7 countries, we should look at testing them. This is the community spread aspect of this becomes increasingly concerning as well. Canada's Chief Health Officer, addressing the media yesterday, talked about how communities as well, various events, occasions are going to have to be looked at as well, potentially moving forward. Have a look.
Organizers of community programs and events should have plans in place based on advice from local health authorities. Public health authorities across Canada at all levels are working together to adapt our response to this rapidly changing situation. Getting informed and working together to prepare is our best option for managing any uncertainty ahead.
Dr. Theresa Tam also brought up the aspect of companies looking at your rostering, looking at your staffing, looking at your supply chains. Are there, for example, key individuals who, without their presence in an office or in a production line, might be problematic in terms of bringing the company to a halt? Maybe you want to do some training programs. Maybe you want to look at responsibilities. Do your employees have the ability? Do they have company laptops? Do they have access to IP addresses that would allow them to work from home? All of these are going to have to be, again, out of an abundance of caution, in preparation. Hopefully it doesn't become that, but the warning from officials is be aware, be prepared.
Can we go back to the events and rethinking potentially events, mass gatherings, as Dr. Tam was suggesting? We talked about how the auto show in Geneva, Switzerland has been canceled. Just getting word, it's Paris Fashion Week coming up.
Yes.
Some Chinese designers have pulled out their shows, and we're also getting, it's in Paris, a big French fashion house, Agnès Bay, canceling its show. So you're starting to see this kind of thing. Do we need to have this now where potentially a lot of people are coming together? And from Quebec, I want to share this with you too. The health minister who was confirming that presumptive case in Quebec says people in the province want to stop maybe thinking about doing the double cheek kiss that is so prevalent in Quebec. It's the tradition, of course, but for now, while there is this outbreak, maybe go for, the fist bump or the elbow or the fist bump, no shaking hands, no two-cheek kiss. This is what they're thinking about in terms of changing perceptions. Hospitals and health facilities, I'm thinking, John, they must be rethinking things as well.
Absolutely. And again, this is out of the need to be prepared. So, and a lot of this coming out from what we remember and what has been learned and effectively workshopped since 2003 and SARS, where many of the healthcare facilities were caught flat-footed, lack of protocol, lack of equipment. So let's look at the list of healthcare facilities and what they're going to be looking at in terms of masks and gloves, other aspects that they're going to, gowns, of course, testing supplies, and the ability for patient isolation. Do they have effectively the real estate in the hospital? Do they have the ability to isolate patients? And of course, antibiotics and antivirals as well. Potential testing programs. Again, much of this has been in effect since SARS, but they're asking, especially, for example, nurses' unions saying, take a closer look at this. Are we prepared? Do we have the protocols? And do we have the experience, whether it's in and out of protective equipment, where is that protective equipment, how do we access it, but just the actual physical act of getting in and out. Is there a buddy system? Do you help each other? All of that, they're hoping people sort out in these facilities before they really need to use them.
In advance. John, thank you very much.